And I want to touch on another issue where we are making really significant progress, but we're going to run into enormous opposition. 4 years ago, when I came to New York and to other states, I said, health care is a human right, not a privilege. And I said that it is an embarrassment for this country to be the only major country on earth not to guarantee health care to all people as a human right. Not to mention that in the dysfunctional system we have today, we are spending twice as much per capita on health care as do the people of any other country. Not to mention that every day we are getting ripped off by the drug companies who charge us the highest prices in the world for the medicine that we need. So over the last 4 years, what's been happening is people have been taking a look at the healthcare system because we've been talking about it. And people are beginning to say, wait a minute, we're spending twice as much as the people of any other country, and yet 87 million Americans are either uninsured or underinsured. That's pretty crazy. We're spending more than any other country. 30,000 people a year die because they don't get to the doctor when they should because they're uninsured or underinsured. And here is something that, again, when you take a deep breath and you take a step back and you think about it, you say, this is really, really crazy shit. And that is, and I want you to think about it. Point that I'm trying to make is you don't hear Congress talking about it. You don't hear CBS and ABC talking about it. But we have got to take a deep breath and ask ourselves this simple question. How can we allow not only 30,000 people a year to die, but 500,000 people a year to go bankrupt because they can't pay their medical bills? Think about it. Think about it for a second. And when you think about it, here's what you got to think about. Somebody is diagnosed. Somebody is not feeling well. They go to the doctor. Doctor says, I got some bad news for you. You have breast cancer. You have another form of cancer. Serious stuff. We're going to have to treat you. It's going to be hard. And people, you know, they're reeling with this diagnosis. And they're figuring out, okay, now, what doctor do I go to? What kind of treatment? Who has the best ideas? I got to research this. I got to do that. And if I'm in a hospital, who's going to be working to feed my family? And what hospital do I go to? And all that stuff. A lot of things you got to be dealing with. But can you imagine the people who are dealing with cancer, who are dealing with serious heart disease, who are dealing with somebody in the family having Alzheimer's or whatever, and then on top of all of that, understanding that if they get a bill for $50,000 or $100,000, they are going to go bankrupt. Their credit is shot. They are in financial ruin. Take a step back and think about the barbarity of a system which destroys people's financial life. For what reason? Because they came down with cancer or heart disease? That is disgraceful, and together we're going to end that. And I want to just say, what I'm talking about is not radical. It is, you know, I live in Burlington, Vermont. I live 50 miles away from the Canadian border. Does anybody happen to know that if you go to the hospital in Canada with serious surgery, what is the bill when you come out? Anyone know? That's right. That's exactly right. It is zero. You go to any doctor you want. You don't take out your wallet. You don't take out your credit card. Your health care needs are treated because you are a human being. The doors are open to all. So what our Medicare for All program is about, we expand Medicare to cover dental care, hearing aids and eyeglasses, and home health care. And under our legislation, nobody in America will pay more than $200 a year for prescription drugs. And we are able to do that because we're going to lower the cost of prescription drugs in this country, because we're going to end the absurdity of the drug companies being able to charge us any price they want. So when you talk about a dysfunctional system, I don't know if any of you know, last month I went up to Canada with a bunch of people who had diabetes. The diabetics who were with me were able to buy insulin for 1/10 of the price they paid in the United States. Can you believe that? And actually, Canada's drug prices are fairly high internationally. So we're going to tell the drug companies they're no longer going to rip off the American people. We're going to lower their price. Nobody in America pays more than $200 a year for the medicine that they need. And what Medicare for All is about, not a radical idea. We're doing away with all premiums. We're doing away with all co-payments. No more deductibles, no more out-of-pocket expenses. When you get sick, you go to the doctor. And we're going to pay for it as every other major country pays for it out of the general tax base. We're going to do it in a progressive way, which means that the overwhelming majority of the people will pay less for comprehensive health care than they are paying right now. And the way it works, you know, I've been attacked, we're going to disrupt the healthcare system. That is absolutely untrue. Here's the way it works, pretty simple. Right now, you have people 65 and older are eligible for Medicare. We're going to lower it to 55 in the first year, 45 the second year, 35 the third year, and fourth year, everybody is in. Healthcare for all, it's a human right. Now, I should tell you, though, because it gets back to not me, but you. Most people in America think that's a pretty good idea. But there is a small group of people who have a modest disagreement with us. And those are the greedy folks in the insurance industry and the drug companies who last year made $100 billion in profit. And they kind of don't think that Medicare for All is a great idea. So what you will be seeing now, think about it. You make $100 billion last year. You take 1% of those profits, $1 billion, you put it onto television ads and radio and newspaper, all that stuff. And they are going to be all over this country, running all kinds of ads, demonizing me, demonizing Medicare for All. All that I ask you, when you see those ads, understand who is paying for it. Understand that what this whole thing is about is they will do everything possible to protect their enormous profits. They could care less whether people die because they don't have health insurance. They could care less if people cannot afford the medicine they need. All they are worried about is their profits. And we got some really bad news for them. We are going to create a healthcare system that guarantees healthcare to all in a non-profit way. But I need your help. This is a human rights struggle. Understand it. for what it is. Either health care is a human right or it is not. We believe that it is. We must have the courage to take on the insurance industry and the drug companies.